Prostate cancer is really in a dynamic state right now, and it's an exciting time for patients and for caregivers and physicians alike. You know, for the past probably 70 years, we've focused primarily on hormonal therapy, androgen deprivation therapy, in particular for patients with metastatic advanced prostate cancer. And over the last few years, that landscape has changed with the approval of and the data showing clinical benefit associated with upfront use of docetaxel, then abiraterone, and most recently androgen receptor antagonists such as apalutamide and enzalutamide in this landscape of patients with metastatic hormone-sensitive prostate cancer. And the repercussions of that are being felt downstream. So now we're seeing patients entering into the castration-resistant prostate cancer setting having been exposed to some of these drugs. And I think we're going to have an opportunity to treat earlier with some either novel agents that are going to show promise in that sort of post-AR, post-chemotherapy setting, or with other cytotoxic agents that are maybe novel in the field and targeting the disease through radiopharmaceuticals like radium, docetaxel, cabazitaxel, as well as novel agents coming in that may be other ways of targeting, say, PSMA and other strategies. So there's opening up room for clinical trials. Patients are going to live longer and have more time to go on those studies, which is exciting. We're going to have an opportunity to treat patients earlier in the disease with life-prolonging therapies. And I think we're going to begin to see some of these things translate into the curative setting. And that's probably the most exciting change in the field that's coming, is sort of where, you know, we move from our investigational agents in the late stage all the way to the early stage. And just this change in landscape, it's really a paradigm shift for how we think about managing our patients with advanced prostate cancer.